Hello, I'm Dr. Nanditha Arun. I'm a physician specialized in diabetes working in India. Today I'm going to talk about type 2 diabetes and its association with cardiovascular disease. Type 2 diabetes is primarily a lifestyle disorder, and the number of people being diagnosed with diabetes is increasing in alarming numbers all over the world, especially in countries in Southeast Asia, including India and China. The number of people currently living with diabetes in India is estimated to be around 65 million, and this number is expected to double over the next few years. Diabetes affects almost every part of a person's body, and even the vital organs, including the eyes, the kidneys, the nerves, and the heart. However, the leading cause of death in people with diabetes is cardiovascular disease or heart disease. It is in fact believed that a person with diabetes has a risk almost 2 times higher to develop heart disease as compared to a person without diabetes. Cardiovascular disease in diabetes is mostly coronary artery disease, or commonly called as a heart attack. The risk factors for a person with diabetes to develop heart disease are many. Some of them are uncontrolled blood sugar, uncontrolled cholesterol, blood pressure, poor lifestyle habits, which includes unhealthy food habits and poor physical activity, obesity, smoking, excessive alcohol intake, and also a positive family history of heart disease. Now, if we look more closely at these risk factors, it becomes evident that many of these factors are actually modifiable, which means that they can actually be corrected or at least controlled. For example, uncontrolled blood sugar. A person with diabetes often tends to neglect a good control of their blood sugar, especially in the early years. And the reason for this is simply because many with diabetes remain asymptomatic or complaint free, especially during the early years, and hence nothing prompts a person to visit their doctor more frequently. However, it is known that good control of diabetes and blood sugar in the early years is extremely crucial to reduce the risk of heart disease in the years to come. And this has often been termed as the legacy effect or the metabolic memory. Good control of diabetes would involve regular visits to your doctor, taking your medication regularly, and all this will actually help not only to control your blood sugar, but also blood cholesterol and blood pressure, and also other parameters which the doctor will check. Other tips that a patient must follow are to adhere to a healthy lifestyle, which includes good dietary habits, which will involve reduced saturated fats, more of vegetables and lean meat, to adhere to a good exercise regime and at least increase physical activity as much as possible, stop smoking and reduce alcohol intake. All these factors put together can actually reduce the risk of development of heart disease in a person with diabetes. With these tips, this is Dr. Nanditha Arun signing out, wishing you all a healthy and a happy life living with diabetes. Thank you.